cause of death in the United States, and the third leading cause of sudden death in men who are over 60. And ladies, men are affected more than women by almost a 4-to-1 ratio. What are the risk factors? Basically, you've heard these all before pretty much. Smoking, if you have a family history, in other words, if your father had one or your brother has one, it's possible that you might have one. Something to think about. We talked about the male to female gender and all the other risk factors, high blood pressure, COPD, that's lung problems. Mostly people get that from smoking cigarettes, but if you have bad lungs, you are at higher risk for developing this particular disease. And if you have other blood vessel disease, such as pain in your legs, and you have what's called claudication and other diseases of the blood vessels of your body, you may be at higher risk for having an abdominal aortic aneurysm. There's some more pictures. You can see again, this is the schematic, again, the kidneys here, and the bulge in the blood vessel right below the kidneys going down to the blood vessels going to the legs. You can see with part of the body. This is again a reconstructed CAT scan, which we do preoperatively, and this is a blood vessel x-ray called an angiogram. Once more, you can see the aneurysm going down to the legs, and there's the kidney arteries right there. So it's always below, the ones we're talking again are below the kidneys. And there's, we don't see this too often, this is a nice thin patient, and you can actually see a bulge in the abdominal aorta. Sometimes, if you're very thin, you see people that are laying down, you can actually see it. So, we all know some people that have had abdominal aortic aneurysms just off by heart. Rodney Dangerfield, he had an abdominal aortic aneurysm that was repaired. Bob Uecker, Mr. Baseball, he had one, was fixed. Bob Dole also had one. George C. Scott, Lucille Ball, she died of a ruptured abdominal aortic aneurysm. And I would say that one of the more interesting stories of people that have had abdominal aortic aneurysms are attributed to this man, who in 1947 was diagnosed with an aneurysm, and in fact his surgeons wrapped the aneurysm in an operation with cellophane. You can see they had this big bulge and they wrapped it in cellophane to try to prevent it from rupturing. He lived for about 6.5 more years when the aneurysm in fact did rupture, and he was offered the possibility of an operation again, although in those days there was really no accepted or general repair for these things. People were just going to try to operate on him, try to save his life, and Einstein basically said